This is Gam Chat. My name is Greg.
I'm McCoy.
And I'm D.
We're three Filipino gay guys trying to make sense of anything and everything in the world today. Welcome to our podcast.
Hi guys, how are you guys doing?
Good.
Good. Another week that we're at home, right? But
Yeah.
by choice, so want to keep everyone safe.
That's so nice of you, D. By choice. Shelter in place. SIP.
How about you, Greg?
I'm doing, I think this week for me was wellness week, mental wellness week for me. So yesterday I took my mom to the beach, and then today I took myself to the beach. So it was nice.
Wait, did you just take her there and leave her by herself? Or did you join her?
I think I buried her in sand somewhere. No, my mom hasn't been to the beach, and I was like, when was the last time you went to the beach? She's like, I don't remember. So I said, oh, we have to go to the beach.
Oh yeah.
So I took her to the beach. It was really nice. We went to Orange County, so a lot of people weren't wearing masks. But that was a little frightening, but at least we're out in the open. We wore masks though, like good Asian Americans.
How about you, McCoy?
Well, I'm back in the office, officially, I guess. Full time. Before this, I would come in once a week only.
Oh, is it mandatory now, or is it by choice still that you can come in every so often?
Officially, it's mandatory, but not really. Like I can still work from home if I really wanted to, but I just find it easier to do my job when I'm in the office. But yes, I'm a little bit concerned, but at the same time, I'm not, because they instilled like a culture of always watching what you do. Don't touch your face, and we have to wear a mask when we leave the office, or when we step out of our office, and then wash your hands. Use sanitizers every time you come back to your office. So you just have to be aware, hyper aware.
Yeah.
Yeah, I'm not ready to go back into the office yet. I kind of like working from home. No, I don't. No, I don't kind of like it. I love working from home.
I can't get anything done. My normal routines at my desk where
Yes.
I like that divide of I'm at work.
Yes.
I am leaving work. I'm gonna leave everything at work and I'm gonna go home.
Yes, I agree.
So I miss that. Luckily, I can go to the office. My work, we space out whoever comes in. So I will come in. Someone is gonna come in the next day and take a break. So if I have to come in, we kind of scheduled with each other, so it makes it easier and safer for everyone. But
Well, I work in our department. We have our own offices because I'm fancy like that. But but when all this started and we had to work from home, I thought, oh, how fun! I've never done that. But then I realized maybe 2 weeks after, I'm like, oh, I don't like it. I feel so much more tired. Like I look at my bed while I'm working. I'm like, I wish I could jump in. But then when I'm in bed, I look at my office. I'm like, oh shit, the stuff I have to do tomorrow. I don't like it.
You guys are such newbies. Come on, man. Like,
Just because I don't like you in the office.
hey, I did freelance for how long? So I had that experience where you're editing and folding laundry and your dog is sitting on your lap. So I've done that for how many years? So I kind of like the office setting a little bit more now.
I get it, but I'm like SIP for life.
Oh, golly.
That's what I like.
So what are we talking about today?
Today we are talking about the big elephant in the room, the monster outside, COVID-19.
Well, what are the numbers now?
So as of August 9th, 2020, we are looking at almost 5 million new cases. I mean, of confirmed, sorry.
Total cases.
Not new cases, total cases in the United States, and a total of 161,000 deaths.
Wow.
As of August 9, 2020. That's I find that really depressing.
And that is the entire U.S., right?
That's just the entire U.S.
Yeah.
And isn't the U.S. the top number one or number two in the
Yeah.
world?
No, not number one on total cases. Yeah. I'll be honest. I haven't really looked up the numbers because it makes me sad. So.
My morning routine is to listen to the news when I'm making my coffee, doing everything else. I just like pop in Amazon, play NPR, and I hear the numbers. sad to say I've kind of gotten used to just ignoring the numbers because it's so early and I don't want it to affect my morning, but I know I have to know these things
Yeah.
to make sure that I am aware, and it forces me to be even diligent and like keeping everyone else safe, not just myself. So
Yeah, I don't know. I still find them so depressing, and I don't think I've checked these numbers in a long time, which just for my own mental health, I've been avoiding it, but avoiding doesn't really get you anywhere, I guess. So I think you have the right track.
Yeah.
Since today's topic is about COVID-19, we thought it'd be such a good idea to talk to someone that's on the front lines. So we reached out to a mutual friend of all of ours. His name is Rich, who is a nurse. And McCoy had an in-depth conversation about the subject matter. Why do you think it's important that we're having this conversation with him?
For me, I only see this COVID from my point of view, and to me, it's not enough. I wanted to see it from a frontliner's point of view. I want to see what's going on and how he deals with this and how it's affected him personally and also his work.
Yeah, I'm really excited to share this interview, this recording with everyone. So let's take a listen.
So, Rich, I want to thank you for taking the time to join us. How are you doing?
Oh, thanks for having me. So far so good. So far so good in these times of the current pandemic. I could be better, but so far so good.
I know you have family members that are also frontliners. How are they doing?
They're doing okay right now. They're trying to cope with not only just the virus, but everything that's going on regarding, everyone staying at home, the kids staying at home. So far, everyone's healthy, but they were not in the very beginning. My brother-in-law was positive, and it took him about 3-4 weeks to finally get better, and so he's back with his family.
Okay, that's good. And he tested negative again, of course.
He tested negative twice. He actually was positive, tested positive again, became negative, and had a second negative. So now he's back with the family.
Oh, that's good. Is he back at work, or what? How does that work?
He's back at work.
Uh-huh.
Unfortunately, us, like the nurses, are not able to just take time off. Once you become positive, now you're quarantined. But once you get your negative, you're back at work.
Yeah.
And with work, everybody's rotating between the COVID units and non-COVID units. Unfortunately, his first day was back in the COVID unit.
Wow.
Yeah.
Well, sometimes I'll watch the Filipino news, and that same thing happens in the Philippines, where they're like short staffed as it is, and people get sick, or people die actually. So it's hard. I can only imagine. Well, how are you coping in the workplace with this new pandemic?
We're coping okay. There is a level of stress that is significantly high. That's always been there since the beginning. Has it gotten better? I would say it's gotten a little bit better now that we have an idea of what we are doing and we have all the supplies that we need. Is it better? It's okay. How's my stress? It's still there. Patients are still dying. Patients are still coming in. Even when we discharge patients, we're being asked to take patients from different areas in California. So it's not like our census has completely gone down, and patients are getting sicker and sicker. And I feel when a patient normally comes to the hospital, they usually go out. It's kind of right now, it's like 75-25 if they're going to go.
Oh, wow.
If they're leaving the hospital, either home or elsewhere.
Well, I know when all this started, it was a lot of confusion, chaos on what the guidelines are. So you're saying it's a lot better now? Hospitals have a better idea on how to handle this?
Yes and no. No, because it's still unknown. There's still we're still having a hard time trying to figure out, how to treat this patient, because there is no treatment.
Yeah.
The treatments that we're doing for these patients are just symptomatic. So they come to the hospital, they're positive for COVID, and they're only being admitted because now they're in respiratory failure, right? So they can't breathe on their own. They'll require either a vent or high flow of oxygen. These patients either have pneumonia, they have fluid in their lungs, they have fever, they're septic. So these patients really have to be here. So these patients are staying in the hospital for, I would say, 4, 5, maybe longer weeks in the hospital if we aren't discharging that many patients home. And even if they're discharged, they go home, they're still positive, but they no longer need that oxygen support that they would in a hospital. We're doing okay, but I can tell you other hospitals, they're not. Other hospitals, all their ICU beds are full. Most of these patients are in an ICU bed or at least some form of telemonitoring. But I can tell you in California, we are really running out of hospital beds. In fact, my hospital, we are taking patients from different counties. We're taking them from down south in El Centro, we're taking them from Bakersfield, we're taking them as far as up north in California. So, if we have a bed that's open, that's not being utilized by a COVID patient, then it's being utilized by another patient from another county.
Another area, yeah.
Yep.
Do you feel that you are given the tools that you need to perform your job?
I feel we are, but you do hear stories on TV that they're not. I can say, fortunately, I am. We do get donations. We do have our PPE that we are constantly purchasing. We are trying to be smart about the use of our PPE.
Yeah.
Normally, in normal non-COVID situations, it's one N95 per patient per visit, right?
Yeah.
So we could use up to 20 N95s for that one patient. Now we're using one N95 per shift. So what's the normal is completely gone. So we have an N95, but we are also putting a second layer. So we have another mask above our N95, and we keep that on the whole day.
So you do have to wear a full PPE if you're going to deal with COVID patients. How does it feel to be in one of them?
At the end of the day, you will see marks on your face.
Yeah.
Your ears are completely sore.
Mm-hmm.
You are sweating because not only do you have your mask on, but you also have other gear that I didn't mention earlier. You have your mask, you have your N95, you have your mask. You have either your goggles or your face shield. Some folks have hairnets, and some of you have your full gown that you have. So you're wearing quite a bit of PPE, and you're having to wear that the whole entire day. Some folks that are not able to use an N95 do have a PAPR, so it does. And what a PAPR is, it's like I would say like a spacesuit. So you're wearing a spacesuit and you're wearing that the whole day. And it has to be fitted. At the end of the day, you have to submit it. It gets cleaned, and then you come back the next day and you're using the PAPR again. In the very beginning with the N95s, we were running short. There were even talks about having those N95s collected, disinfected, and reused again. These N95s were being placed in brown paper bags.
Yeah.
Luckily, with our strategic use of these N95s, we're not having that waste that we were in the very beginning. But we also getting a lot of donations, which is good, but not enough. Hospitals are still struggling. Even when you get that donation, you have to get it fitted, because you can't be given an N95 and say it's going to work on you. It has to fit your face.
Oh, this gets really, really complicated. I never knew. A lot of that I never knew. So I can just imagine that's really, really challenging. With all this going on, I mean, the news, even social media, you see people who refuse to wear masks, get in fights because they don't want to wear masks, even protests because they think their freedom is being taken away by being forced to use a mask. How do you feel about that as a frontliner? How do you feel that some people feel that they don't need to wear a mask or they shouldn't be forced to wear a mask?
It makes me angry. It really does. Your line of defense right now is wearing a mask, social distancing. I really, really get upset seeing people not wearing a mask, or I really do get upset at people, I see them on TV not wearing a mask, really arguing on not having it, and being around other people, and, and possibly infecting others. Working in the healthcare, we see the results of it, and I really feel that if you're not working in the hospital and you're not seeing what we're seeing, that's when you feel like, oh, it's a joke. It's not real. It's just like the flu. If you're not in the hospital looking at patients dying, watching your coworkers get sick, get infected themselves, I mean, I get speechless sometimes. Yeah. It really does make me angry. These people, I mean, I believe that people, you're entitled to your own opinions, but in this state of pandemic in which this disease, this virus is so contagious, for you not to wear a mask, I just feel so reckless. I get very upset.
Yeah, I know how you feel, because it does scare me when people are not wearing a mask. But so it is upsetting. This issue has been politicized, which it should really be above politics, to be honest. Now, the Trump administration and Trump himself has made statements that are misinformation, inaccurate. Sometimes he'll contradict his own people. How do you feel about that? Does that affect your job?
It affects my job because there are those believers of the president. There are those people who do believe anything he says. The team that he has, is the physicians that he has. I mean, if they are, everything that they're saying is based on facts, right? And that's how they operate. That's how they've always operated as scientists. As physicians, they're not acting on emotion. They're just doing everything solely on facts. Unfortunately, our president is just acting on emotion.
Yeah.
You know, what's going to benefit me the best? What's going to bring my numbers up? And it's one of those, just like I said earlier, he's not in the hospital, so he has no idea what's going on. You know, for me, it's like, I want you to go to the hospital. I want you to spend a day. Normally I would say a week. Spend a day in the COVID unit trying to take care of one patient. Let's say he's not a nurse, he's not a doctor. Go in there just to talk to them. Go in there just to, you know, help clean them up. What would you wear a PPE, or would you go in there not wearing one? It makes me upset watching the news these days, because there's a lot of credible people on the media, but then you have someone like this who's discrediting everyone else and making his own opinion and having, you know, millions of Americans believe in what he says really does upset me. And it's his followers that are actually coming back to the hospital getting the care, because now they've been infected themselves.
Yeah, I know what you mean, because he's put a lot of effort into minimizing the virus, and he refused to wear a mask. And of course, you know, some people that believe him or follow him believe that way too, and it's really scary. He's touted hydroxychloroquine as a cure or a treatment for COVID. Has your hospital released guidelines regarding the use of it or its effectiveness?
Hydroxychloroquine. So that medication, it's a medication that, you know, he brought up in the past, right? And then he says he takes it. There is no treatment for COVID-19. The treatment that we're doing right now for these patients who have COVID-19 are all symptomatic treatment. Are they short of breath? Let's treat that shortness of breath. They have COVID pneumonia. Let's treat that pneumonia. They have a temperature. Let's treat the temperature. So those are things that we're using to treat these patients. There is no treatment. There is no cure. We'll try hydroxychloroquine. We'll try remdesivir. We'll try these different medications. But what is actually making these patients better? It's just a combination of all these drugs. I can't say that it's that medication that is the cure of these patients. It's not. There is no cure at this point. You know, there's many companies that's working on a cure, but at this point, it's so sad. You come to the hospital, the patient comes with COVID, and it's like, all right, let's treat this patient. Let's treat their fever. Let's treat their pneumonia. I mean, we're not treating the COVID. Yeah. It's pretty much like if you have COVID at home, but you're having just the fevers, but you're not short of breath, you're taking the Tylenol. Yeah. You're going to the hospital now because you can't breathe. So now we're treating you the same thing. You have a fever, we're treating you with Tylenol. You can't breathe. Now we're putting a tube down your throat. Or we're turning you on your stomach, because these patients who have respiratory failure, they actually do better on their stomach. It's called proning. So we're proning them. We're putting them on their stomach. They're intubated. Right now, at the moment, there is no treatment for this virus.
When people get on the ventilators, is there a high chance that they can get off of it, or do you see instances where they never do get off of it?
Everybody is different based on, you know, if your risk factors. Even if you have no risk factors, sometimes you just don't respond to this virus that well. It really all depends. I've seen patients come off the vent and were able to get discharged home. I've seen patients who remain on the vent and their families have to make the decision to take them off life support. It's 50-50. I would say, actually, I wouldn't say 50-50. I would probably say 60-40. These patients will either stay on it and pass from it, or they may improve. It's hard to say. Everybody's different.
Well, can you describe what patients can expect when they are brought in for COVID?
So let me give you a scenario. So a patient comes in, like suddenly they feel like they're short of breath. They have a fever that they can't kick. They come to the hospital. Your loved one can't come in. You come check into the ER. They start working you up. They test you. They find out that you're positive. You can't breathe. So, you know, let's say either you get intubated. If you don't get intubated, but the doctors feel that your oxygen saturation is not well enough for you to be at home, they'll admit you into the hospital. You're admitted to this hospital in a single room, in a negative pressure room. You cannot be with your family. If you have a phone, you can FaceTime them. That's great, but no visitors. No visitors for regular patients. There's no visitors for COVID patients. you're in that hospital, if you are in the ICU, you are either intubated or you are on high flow of oxygen. So you are completely restless. And again, like I said, either you get better or you end up passing.
LA Times wrote an article, "The Filipinos are dying of COVID at an alarming rate." Can you speak as to why that is?
For Filipinos dying at an alarming rate, I mean, if you think about the demographics of a Filipino, right? So we do have a lot of Filipinos who do work in the hospital.
Yes.
If they don't work in a hospital, they know someone who works in a hospital, and they most likely probably live with them as well. So the exposure of that is already high. Being in a hospital, you're exposed to COVID. Living with your family members, you're exposed to COVID. You just don't know. Sometimes you can be asymptomatic and you don't know it. Along being at home, you probably live with 5, 8, maybe 10 people in your household. A Filipino household. Filipinos are all about family.
Yeah.
So it's not uncommon to have a large group of family members living with you. So the chances of them just infecting each other is probably pretty high.
Yeah.
So I wouldn't be surprised. And then you just think about the, Filipinos. A lot of them have diabetes. Yeah. They have hypertension. They have heart issues. So that alone in itself are risk factors that, can, if you do catch COVID, you have a high probability of being hospitalized and even die.
With your experience with treating COVID patients, do you have any stories you'd like to share?
It's sad. I do a lot of the stories that I'm seeing right now are just patients dying alone. Patients are dying alone. And, from the very beginning, I would say that when I think the first 2 weeks when this occurred, I'm a very emotional person, right? So coming home, after a 12-hour shift, I came home and was having dinner with my husband. I was just there at the table, just quiet, right? Quiet. And then, he asked me what's going on. And then I just broke down in tears. What's changed for pre-COVID and current COVID is that if the patient is dying, if they're coding, let's say their heart stops or they stop breathing, you cannot enter that room until you have your full PPE. So that patient can be dying in there, in that room. No one is doing anything. Then the hospital staff, you have to protect yourself, or there is no hospital staff. You make sure you get your N95 on, you put your mask on. If you have a PAPR, you put your PAPR on. You check each other, make sure you have no breaks, and everything is sealed. Mm-hmm. Once that's done, now you can go in and start your compressions, start pushing medications for this patient. So you could imagine the time that it takes for you to ensure that you have your full PPE on. As a supervisor, we have to, normally I would be in there, I would be doing chest compressions, I would be pushing meds. My role now is to ensure that everyone is safe. Mm-hmm. I'm standing back, looking at the people inside, making sure that they're doing compressions right, looking at the monitor, making sure that the door is closed, making sure there's people that's safe the entire time, make sure we have runners. And so I came on and I broke down because I felt helpless. I felt like I could not do anything for that patient. I became a nurse because I wanted to help as many people as I can and do whatever I can. But with COVID and the fear of catching COVID and the fear of exposing myself, my family, my friends, even my coworkers, it was scary. And I couldn't do it. I had to follow protocol. I had to follow procedures. I came home and I just cried. I just cried because I felt helpless. And then as the weeks continued, now I'm getting phone calls from family crying because they can't see their loved ones. I'm getting phone calls from family trying to be with their family member who have COVID. Unfortunately, they cannot be in there. I mean, I don't know if you saw the news last week that there was this elderly man who visited his elderly wife who was dying from COVID. They let him in. He sat there, watched her die. He became positive, and a week later he died.
Wow.
This virus is no joke, and it's sad.
I've known you for a while, and I think ever since I've known you, you've been a registered nurse. And I know for a fact you love what you do. Has this pandemic kind of changed the way you look at the career you chose?
It made me appreciate what I did to become a nurse, and right now, and I appreciate what I do now. I love it. even with this COVID and the high chance of exposure, I absolutely love being a nurse. This is what I signed up for, right?
Yeah.
This is where I signed up, regardless of it was going to be someone just having chest pain and there's no risk of exposure to COVID-19 where there's a high chance of exposure. I signed up to be a nurse for this very reason, to help people when people cannot help themselves, or there's people out there who can't do what we do. I love it. That's why I have not stopped work. There's a lot of nursing jobs everywhere. I had the opportunity to just stop work and just jump back in when all this is gone. I don't. I canceled, all my vacation was canceled, but I didn't stay home during my vacation. I canceled my vacation. I came to work. In fact, I work 2 hospitals. I work 6-7 days a week sometimes. So I'm still working almost every single day. So I love being a nurse. My mom is a nurse. My sister's a nurse. My sister's a pharmacist. We're all in the healthcare field. And none of us have stopped work. We all love what we do. We are still doing it.
Well, I know this pandemic has made life very, very challenging, especially for you guys. So I really, really want to thank you for doing what you do. It's not easy. It's challenging, but there's rewards to it. So I just want to thank you for doing what you do and also for taking time to join us and talk to us about this.
Well, thank you for having me. I appreciate it.
Yeah, I mean, that was an enlightening conversation, and thank you, Rich, for sharing his perspectives from a nurse in Southern California. I think that was a really good conversation.
Honestly, when I was listening to it, halfway in, I really decided I needed to hear this. I needed to hear the stories that he shared. We had an idea watching the news, people sharing Facebook posts, but to hear someone speak their own experience, having it firsthand, it just changed how this pandemic is affecting not just everyone, but people that are right there fighting the battle for us.
Yeah, I agree with you. This has been like really enlightening to hear this, and it really makes it real. Like, I don't know, like, I guess watching on the news about COVID-19, I know friends of friends and relatives of relatives, just relatives who got COVID, but to hear like him speak about it and get emotional, I think it really hit home for me.
Yeah, I mean, I've known him for a while, so hearing him say that he broke down crying, it's upsetting for me because he's such a fun-loving person, but when it comes to his work, he really takes it seriously. He really loves what he does. But it was interesting to hear his thoughts and see it from his eyes, what they have to go through every day, not only here but all over the world and even in the Philippines also. So
I realized my first thought was that I felt like for all this time since this was happening, I somehow removed myself a little bit from the situation, or I've been so caught up in the hydroxychloroquine kind of debate or the Trumpism about this pandemic, and it somehow removed just the realness of what's going on for our frontliners and for those families to hear that patients are going in and they truly are alone, like dying alone, makes it just even more real to hear. Yeah, it's just, I think really hit hard for me.
I think my takeaway from it was I've always known that the hospital and the medical people's aim is not to cure this. Right now, all the tools that they have is really to treat the symptoms. And I think that's what everyone is forgetting, that you're not going to the hospital because you're being cured of COVID. They're treating you for your high temperature fever, if you're coughing. I mean, worst case scenario, you're going to be on a ventilator because you're not able to breathe anymore on your own. That's not curing what caused it. It's just treating the symptoms. There's a chance that you can get better. There's a chance that it might not. And those are the chances that you're taking when you're really stepping out there and not caring for everyone else besides yourself.
Yeah, I agree with you. That hit me too. It's like, I don't know, you go to the hospital to get cured and you know that people are getting better, but when he said like they're just treating the symptoms, there is no cure for this virus yet. That was just like, oh, that was a little bit of an awakening for me. Go to the hospital to get cured, but you're actually, it's like the virus is just on its own course, and everybody's body is different and reacts to it differently. So that was that was a reality check.
What was your takeaway from him, McCoy?
The fact that going to work for him and for other frontliners is like risking your life, but they still do it because they chose that job and they love what they do and feel like maybe they don't get enough credit. But here's the thing, it's like they have to deal with this every day, right? And the rest of us can separate ourselves from the fact that this is going on. We can choose not to pay attention. And there are some people that are not following the guidelines by they don't want to wear their masks. They think they don't believe it. They downplay the virus. By not following the guidelines, you're not helping the medical community treat you because you're adding to the numbers and you're spreading misinformation by not following the guidelines and by saying this doesn't really exist or the mask doesn't really work, stuff like that. So it's kind of upsetting.
Yeah, it's upsetting because hearing that individuals, no matter where you are in the world, are dying alone. And he was talking about how when someone's having complications in the hospital, that the nurses have to put on their PPE before they could really help them out because it's dangerous for their lives.
Yes.
That was another kind of a shocking realization. Like, oh my gosh, I mean, we don't realize how much the nurses put themselves through emotionally, physically. He's working about 7 days a week. And another shocking one was how he's dealing with patients all the way from El Centro, California, which is 4 hours away from his hospital. And so if you live in El Centro, which I know that got hit hard in California, but if I got COVID and had to go to the hospital, I may not be in my local hospital. I may be sent all the way up north to an ICU bed and be very far away from my family. That's scary. Like, I do not want COVID. I don't want to test those limits.
The distance really at this point right now, if you remember, that has nothing to do with it. Because even if you're hospitalized, it's not like your family can visit you and be by you. At the same time, I myself, if I was in that position, I wouldn't want my family be next to me or even step foot at the hospital because they'll be risking themselves more. So just know that when you get to that point, you are alone except for the people that are helping you, who signed up to put their lives on the line every day to help everyone else who's in the same boat as you are.
Do you guys remember that movie with Dustin Hoffman about that monkey who gets...
Yeah.
What movie was that called?
Oh, no. Contagion? No, hold on.
No, that's another one. Outbreak.
Outbreak, yes.
So there's a scene... So when this all happened, I remember they were showing Outbreak on Netflix or Hulu or something, and it's this mom and she has a child and she gets sick, and then she has to leave with a suitcase, and her daughter can't hug her, and then they cut to the scene when she already passed away. I remember that. I'm like, oh my gosh, how horrifying it is. And it also makes me think, recently my mom told me that someone from her Filipino Catholic church, that a mother and son passed away. I think he got sick and then she got sick. And it's just hitting all of our communities just right at home. It's sad, and to be so far away from relatives. And what, you're going to FaceTime? Hospitals suck. If you ever stayed in the hospital, they just suck. And to not have relatives at your bedside, that's hard.
Yeah. But then again, hospitals are not supposed to be fun.
Yeah, I wasn't thinking it's Disneyland. I wasn't trying to say it's Disneyland or anything, but
Trust me, remember I was hospitalized last year. That was an expensive vacation that I could have just spent time in Palm Springs for. So I was Palm Springs or hospital for 8 days. Yes, yeah.
No, I remember when I got my appendix removed and I was in the hospital for 3 or 4 days. I was awful. You couldn't sleep. It was just uncomfortable. But at least people could visit me.
Yeah.
Yeah.
And that's horrible.
Yeah.
One thing that I actually do like that you guys discussed, McCoy, was how it hit our community, the Filipino community.
Yeah.
Because definitely there's this stereotype that, oh, you're Filipino, you must be a nurse or, something in the medical field.
Yeah.
And I think 2 out of 3, I'm so sorry. Well, Greg, you're somewhat in the medical field because of your family as well, but pretty much we fall into that stereotype.
Yeah.
I think there was that article in LA Times that I think we can link that probably below in the description if that's okay. It discusses that when you look at the ratio of Asians being affected by COVID, it's very low. But if you break that down, Filipinos are hit hardest because most of us are frontliners. Some are nurses, whether pharmacy tech. We can play, what is it, like 6 degrees of separation, and we'll probably get away with two that we know someone in
Yeah.
medical field, and that's close proximity to us.
Yeah, that's another thing I totally just connected. That all the people, like at least my mom knows in the medical field, that are Filipino, that are either nurses or doctors, it has wiped out Filipino families. From the mom's a nurse, then she gets it, and then the husband gets it, and then the son gets it, or the daughter gets it, and it's just wiping out entire Filipino families. It's just shocking, sad. Yeah.
And also, sometimes because we're separated from the frontliners, sometimes we forget that they're people and they have to take this stress home and how it affects them in their daily lives. I mean, in the Philippines, because I watch Filipino news, their coworkers are dying and they feel helpless and they feel like they're not being provided the tools to protect themselves and to do their job.
Yeah, this pandemic we're in it for the long haul, it seems like.
Yeah.
Oh yeah, I don't see us getting back there. I mean, this is just trivial things, but Disneyland canceled their Halloween events that they normally do. Knott's Berry Farm canceled it, and those are things that we just kind of gotten used to. Like, okay, it's this time of the year. I don't honestly see how Christmas is gonna function this year, but that should be the least of our worries. We really just need to prioritize, like McCoy, you said,
Hmm.
these frontliners are short in equipment, supplies, PPEs. The least we can do as people who are not directly fighting this hands on is wear a mask,
Yeah.
stand 6 feet away from other people, really caring for each other. That's all we can do right now
Yeah.
to beat this.
You put into such good words of we need to do better at caring for each other, because at the end of the day, it's like lives, like like nurses or frontliners and doctors who really have to take the brunt of this pandemic on a daily 24-hour basis. um, and the people who are not frontliners, we could do so much better, and so simply by wearing a mask, like you said, and social distance and washing your hands, wear a mask. And because we're fortunate that we're not a frontliner, that we don't have to, we could go home, like we said, McCoy, and turn on Netflix, and there's a lot of people who are taking care of people who can't do that. I think that's a good one to leave to end it with, is like we need to do better taking care of everyone.
So the people that don't wear mask or don't believe in wearing mask, where do you think that comes from?
I honestly don't know. I think we've had this conversation before that I wasn't around yet when it first took place, but it's my instinct right now: get in a car, put the seatbelt on. And I've gotten myself used to, like, I'm gonna step out, I need to put a mask on. I know I want to take care of myself and others around
Mhm.
me. So I'm gonna do what has been proven to help not spread it and not get anyone else infected.
You guys want to hear my conspiracy theory?
Go ahead.
All right, so you're asking where did it come from. My conspiracy theory, no, not my conspiracy, this is just my theory, is this all comes back down to the coal industry. And here's why I say that. It was the coal industry that made us deny climate change, that made us question the science, and made us question science professionals. And I think that has grown and grown and been politicized. Like, we're politicizing this pandemic how we're politicizing climate change. Don't you think? Like, you
Yeah.
have half people believe it, half people don't. And then people who don't believe it totally disregard the science or the medical professionals who have no stake in the game other than to give us the data and to inform us. I think from years of denying science because of climate change that was been lobbied by the coal industry, now we're at a time where we don't believe in the doctors and medical professionals because we've been politicized.
Don't you think it's also the oil industry?
It's all those industries. It's all those lobbyists.
Well, when you say that they deny science, it's not that they deny science. They look for science that will prove their point. what, like 80% of scientists believe that climate change is it's caused by man, but there's a minority that doesn't believe that.
There's a lot of things we have to look at with science, but I
Yeah.
think what the problem is that when you could grab one piece of research and you could conflate the numbers or read into the numbers the way you want it to be seen, that's problematic.
Yes.
And I think that's what's happening. For example, like what are we talking about? The new hydrochloroquine, right?
Yeah.
Like, Dr. Fauci says that even though that the study that keep referencing has been peer reviewed, it doesn't mean it. It could still be a bad study.
Speaking of Dr. Fauci, this administration has said things that are untrue or facts that are twisted to fortify their message. Trump himself, I mean, let's be honest, he lies and he has no qualms about doing so. Let me just say this before some people say we're spreading fake news. Go ahead and defend Trump on his policies, defend him on his record, but you should not defend him on his lies. You can't keep saying, fake news this and fake news that just because he's asked tough questions that he may not like or they may not like. The shit that comes out of his mouth is easily verifiable. He doesn't let facts stop him.
He literally contradicts his own team all the time. And I think that has completely did a disservice and put so many hundreds of thousands of lives at risk because of misinformation. And I'm always like weary of people saying fake news, that term, because if you think it's fake, then you question news, but you don't say fake news as a cop out for you to not do your research.
But it's become what they say usually, just to if they want to dismiss someone.
Honestly, this sucks. This sucks that people on the front line are trying to do the best to help this, and people still doubt to wear a mask or not.
Yeah.
When I took my mom to the beach, so on the way home, we were passing all these like bars and stuff like that, and they're doing all this like outdoor like drinking on the patios. There was tons of people on the sidewalks without wearing masks, just right on top of each other, like this with that California's not being hit hard right now.
I mean, I don't know where everyone's priorities are lying, but it just doesn't make sense to go on your brunches, sit almost next to each other or back to back with someone, and here's a server with a mask on and a shield, and then you're sitting there with nothing in your face. It doesn't make me feel comfortable, not because he is assuming that I might be contagious, get him infected. It just doesn't make me comfortable because we are at that stage. Like, is that really any better than just getting your food to go and sitting at home in your own comfort? I mean, eat dinner when you're in your underwear. I don't know. Isn't that more comfortable than like in a parking lot?
Yeah.
What's so special
I agree with
about
you.
that?
If your server comes serving you food with a mask, a face shield, and gloves on, there's something wrong with that picture.
It's weird because like the way people think sometimes, if they had just spent one more minute before executing that move, they would have probably corrected themselves or caught themselves like, oh, maybe I shouldn't do that because of this. If they had taken just one more minute to think about the consequences or the benefits of what their actions would be, their choices might have been different from what they're making right. Or am I just too hopeful that everyone is in the same wavelength as me?
Culturally, Americans are just an individualistic society. We just keep thinking about ourselves. And then you see like, Asian countries get it. They're all wearing masks. They're like, yeah, no problem. It's like we do it for the greater good of our like neighbors. How about we just be a good neighbor? How's that? Just be a good neighbor and not get them sick.
Regarding Americans, you say they're very individualistic. This mask issue, I think, when you force them, I don't want to generalize really, but this is my theory. When they're required to wear a mask, they feel like you take away their choice, hence taking away their freedom. And, Americans are very like, I need my freedom this and my freedom that. And I get that. But at times of crisis, we should really think about not only ourselves and our family, but the people around us. And that's the main reason why I wear a mask, because I could be walking around asymptomatic and spreading the virus, but if I wear a mask, it reduces that chance of me getting someone else sick extremely low.
It's also, if you're like, oh, I'm all patriotic, well, wear a mask. Show that you're proud to be an American and wear a mask because you want other Americans to survive. I don't know. Like, it's not that deep.
I think you're asking for too much.
Really? I think that we need to rebrand it. We need to rebrand wearing a mask. Like, I think it's sexy. I mean, you get to have like matching masks with your outfit.
That's what I told McCoy.
I love it.
A couple of days ago. Like, I've switched my mentality to be like, what new bags are out this season? No, I'm like, oh, that mask looks nice. What are the features that it has? What technology? Like, I've switched my game buying masks and different styles, different ways to put it on, origami style. One is just like a one fold. That's what I'm doing for myself. Like, how can I get into this? Let me find ways to enjoy wearing a mask.
Yeah, I'm with you on that. I bought a mask from the Philippines that was hand woven by some province people
Province people.
in the Philippines.
What's a province?
I don't
Person.
know, guys.
Indigenous.
I can't pronounce it, okay? I just want to say it, okay? Because you guys are making fun of me. I'm really insecure right now. I'm really in an emotional space right now.
We are
so-
never. We don't make fun. We try to inform.
It's from a northern province in the Philippines.
You mean a tribe?
Look, the point is, I supported our people, okay? And it cost
You
me
mean a province
and
person?
it cost me $50, okay? So I'm doing good in the world. Don't judge me.
Well, yeah, you call them a province person.
But I'm just trying to be like, oh, forget it. This is gonna fail for me so hard right now. We're getting a lot of comments. They're like, oh, look at that. He's a sellout.
I'll just forward
Listen,
them to
yo.
you, Greg, directly.
No, I give you credit for that. It's good that you're trying to support in the Philippines the indigenous people. No matter the tribe, they need all the help they can get right now.
So buy mask, people. Buy mask. And make it fashionable. Origami. What the hell's origami mask anyways, D?
Oh, I'll send you the link. That thing was nice.
That's not a thing. That cannot be a thing. I don't believe
Hey,
that. That can't be a thing.
Either I make it or I buy it. And if I make
Well, I'll
it,
just
it's
buy
gonna
it.
be
I
like
can't make shit.
it's gonna turn out like a diaper or something. So I'd rather buy someone who knows how to make something.
So what? You have some kind of like swan crane on your mouth or grasshopper?
No, it's just
origami?
the
No, I
way
think it's
it
like
folds,
folded.
and it's like it hangs in your neck.
Yeah, the way it
when you're
folds.
not
Can you
using
please
it.
include that in the show notes, please? I would love to see
Yes.
this.
Wait a minute. Wait. Greg, you really thought he had like a crane sticking out of his mouth, like an origami crane,
Yeah, it's
like
a good
sticking
visual,
out.
isn't it? Like think about it, like a bunch of.
No, that
cranes
looks
with
so stupid.
Oh my god, we've all seen the viral photos of people making their own masks. One had a sponge on her face. Like, come on. Anything's possible in this world. On that note, since we're talking about masks from the Philippines, what's the word of the day?
So our Tagalog word of the day is kalusugan. It means health.
Greg, can you just try that? Just a word.
Okay, so, gosh, you know what? First of all, we've been doing this, and so just be kind to me, people who's ever listening, because, I'm born here, but don't judge. I'm still Filipino, okay? So tell me the word again.
Kalusugan.
Kalasugan. Did I get it right?
Okay.
Did I get it right?
Yes.
Ah, galing, 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 galing.
Okay. McCoy, how would you use that in a sentence? Or
Should I give him a Tagalog sentence?
go for it. Let's try.
Okay. Okay, let's see. So, Greg, pay attention. Mahalagang panatilihin ang ating kalusugan lalo na sa panahon ng pandemya.
Ay, nako. You want me to repeat that?
No, I'll just give you an English one. I feel bad.
Oh
So,
my gosh. Wait, what does kalusugan mean?
it means health.
Health. Okay. So,
Yeah.
and then you said, I'm not going to repeat it. Repeat the sentence,
Okay.
the sentence one more time.
In Tagalog?
Oh.
Okay. Mahalagang panatilihin ang ating kalusugan lalo na sa panahon ng pandemya.
What
Wow,
do you
that
think
sounds
that
really
meant,
pretty.
Greg? Let's just let's do
so,
a wild guess.
Like, yeah. If you want to remain beautiful,
Wow.
wear a mask and keep for your health in this pandemic or this
Okay,
pandemia.
now McCoy, what exactly did you say?
What I said was it's important to keep our health or to maintain our health, especially in this time of pandemic.
I think I
Times
did
of pandemic.
pretty good. I got pandemic, I got health, and if you want to be beautiful, you should be healthy, right? Right?
Oh, yes, or wear a mask from some province person.
Yeah. I think we were
No.
digging. We were like reaching for something that was not
you
there.
guys are just
Yeah.
the key thing here is that I tried. Okay.
yes.
Yes,
that
yes.
is.
Oh,
we all have
absolutely.
to try.
I'm a work in progress. All right. So I think by the end of the season, I'm gonna be really good in bilingual by the end of the season.
Okay.
That's debatable, but
Well, here's the hoping.
Wow, guys! Wow. Did you say hope? Or hope? Yeah. That I'm doing.
Oh, golly.
okay, now you're
Now
just
I'm
trying
just
to
trying to
show
prove-
off
I
of like
know.
all the
Now
words
I'm just.
that you
I'm
know.
literally using all my Tagalog words.
Let's
to make
save
up
it for the
for my-
next episodes, Greg.
how bad I
Let's
am.
save some for the next episode.
Uh-oh.
Okay. And that's the Filipino word of the day.
All right, everybody. That concludes our podcast for this week. I hope you wear a mask, wash your hands, stay 6 feet apart, and do it because you care about your neighbor. And you can follow us, leave a comment, or reach out to us, or just tell me how bad my Tagalog is. How can I do that, McCoy?
Well, they can reach us on Twitter, Instagram, and Facebook at GamChat Podcast.
Or if you want to email Greg some notes on how to say things correctly, you can email us at gamchatpodcast@gmail.com.
And there you have it. Thanks, and we'll see you on the next one.